This video is about OET Speaking Role Play 2. So we are going to focus on Role Play 2 of the OET Speaking subtest. If you have already watched the previous video on Role Play 1, you know the basics, right? But here is something important. Role Play 2 is where many candidates lose marks, not because of language, but because of communication challenges. So today we are going to take it to the next level. We will cover what makes a role play 2 different, the most common challenges, advanced communication strategies, okay, and a realistic scenario and a role play. So let's get started. What is different about role play 2? Technically, the format is the same: 3 minutes preparation, 5 minutes role play. But practically, it feels different because a role play too often includes more challenging situations such as dealing with an angry patient, handling a refusal of treatment, explaining bad news or risk, managing unrealistic expectations, convincing a patient to follow medical advice. So, this is not just explanation, right? This is negotiation plus emotional management plus your communication skills. So, what do examiners expect in role play too? Examiners are looking for one key thing: can you handle difficult conversation professionally or not? So, this includes staying calm, showing your empathy, not arguing with the patient, guiding the patient gently, and trying to find a solution. Remember, you're not trying to win the conversation, you're trying to support the patient and reach understanding. Okay? So, let's quickly look at what many candidates do wrong. When they sound too direct, you must do this. When you're saying like this, you must do this. No, that's not an appropriate way to speak to the patient, right? And sometimes if they are ignoring the emotions, for example, that's not important. No, never do that. And giving too much information at once. Patient cannot handle that much information. And not addressing patient concerns or not acknowledging their concerns and sounding too robotic or memorized. So these are some of the common mistakes, and that will reduce your score in clinical communication criteria. So never do that. Let's look at what high scoring candidates do differently. The first one is acknowledging the emotion first. Before giving information, you have to respond to feelings, right? Examples like, I can see that you're feeling frustrated. I understand the situation is upsetting for you. So, emotion first, then explanation later. The next one is usage of soft language. Yes, instead of you need to stop smoking, you can say, like, would you be open to discussing ways to reduce smoking? So, this sounds respectful and professional, isn't it? And the third one is offering choices. Sometimes patients feel more comfortable when they have control, right? Example, we can look at two options. Let me explain both, and you can decide what works best for you. So you are offering them choices and they feel more comfortable. And the fourth strategy is handle resistance calmly. Very, 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 very important, because if the patient disagrees, for example, say like, I understand your concern. Let's look at this together. So never try to argue with them. And the fifth one, safety netting. Always you have to guide the patient on what to do next. Example, like if your symptoms get worse, please come back immediately. So here you're guiding the patient on what to do next, right? Try to do it in that way. Now, here is a scenario. Setting is hospital outpatient clinic, and your role doctor, patient is an adult patient. And situation is the patient has high blood pressure but refuses to take medication. Patient concerns are doesn't like medicines, thinks lifestyle changes enough, worried about side effects. And your task is to explain the risk, address his concerns, and then encourage treatment and maintain cooperation. Ready? Okay, let me give my response here. So, examiner. I don't want to take these medicines. I think I'll just manage it myself. Hello, I understand your concern. Many people feel unsure about starting medication, especially when they are worried about side effects. Would it be okay if I explain why this treatment is important and then we can decide the best option for you? High blood pressure is often called a silent condition because it may not show symptoms, but it can increase the risk of serious problems like heart disease or stroke over time. I completely agree that lifestyle changes like healthy eating and exercise are very important, and I encourage you to continue those. However, in your case, medication can help control your blood pressure more effectively and reduce long term risk. But I'm worried about side effects. That's a very valid concern. That's a very valid concern. Most people tolerate these medications well. And if you experience any side effects, we can adjust the dosage or change the medicine. You will not be alone in this. We will monitor your progress regularly. Okay? Would you be willing to try the medication for a short period and see how your body responds? Maybe I can try. That sounds like a good plan. We will start with a low dose and review your condition in a few weeks. If you notice anything unusual, please contact us immediately. Do you have any other concerns I can help with today? So, this is the response. Okay. Now, let me tell you why this response works. The first one is empathy. Yes, I have shown empathy, right? By saying, I understand your concern. So that builds trust immediately. And the second one is permission based communication. So I have asked permission to the patient, like, would it be okay if I explains why this treatment is important? So that shows the respect that I'm giving to the patient autonomy. Okay. And the third one is balanced information because I have informed the risk. I have also explained the benefits. So no fear tactics played here. And reassurance, yes, I have given the reassurance by saying, like, you will not be alone in this. So, this reduces anxiety in the patient. And the negotiation, yes, if you see here, I have used the phrase like, would you be willing to try the medication for a short period and see how your body responds? So, here, this way, I'm encouraging the cooperation. Got it? So, here the negotiation works well and clear plan where I have started with the medication. Then I told like we will monitor, then follow up. So this shows the strong structure. So finally, you have to stay. So here are the final takeaways for you. You have to stay calm and professional. Always acknowledge emotions. Try to avoid direct commands and use simple and clear language. And try to involve the patient in your decisions. And finally, end with a clear plan. So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.